Hello everybody, welcome back. Dr. Marc DuPéré, plastic surgeon, VISAGE Clinic here in Toronto, Canada. Thank you to my patient for agreeing to this filming. Today I want to discuss something very nice, is fat grafting to face. Now in my practice when I meet patients, we talk about rejuvenation versus transformation. So rejuvenation is the one that we all know about. Is as we get older, we get jawlings, we get tear trough, we get shadows, hollow temple. So when we rejuvenate those areas, we are bringing them back to what they used to be 10, 15, 20 years ago. So we're not changing the patient into somebody different. We're just going back in time to a more youthful herself or himself. Now, transformation is when we give a patient something that she or he never had. And that can be natural or unnatural. So we've all seen the unnatural transformation. And again, at VISAGE Clinic, we do favor natural results. We're known for natural results, especially that patients today do a lot of those procedures, filler, fat grafting, for self-portraits, for photography, for posting online. It's a big thing nowadays. So they want something that's natural, and we like our results to be natural as well. Now this young lady is known to me. She had lid cheek trough. She had tear trough shadows that made her look older. She's only in her mid-30s. She told me that I believe her dad has similar eyes, so there's a genetic component to this. There's a bit of aging too, and it makes her look tired, somewhat sad, and she wanted to restore this area to what she used to be in her early 20s. So that's a rejuvenation. Her chin. We met a year ago. She had a very, very, very small back positioned chin, what we call in plastic surgery a weak chin. We did a chin implant, and it's deceiving in that position because the tube from anesthesia push everything backward, but she has a good projection now with the chin implant. I had to use the largest implant we had to match her nose, and it looks beautiful, but she's hoping for a tiny bit more projection forward. She's happy with the vertical height that we've given her with the implant. She wants a tiny bit more projection. Now, the fact that she never had a strong chin and we went with an implant and now fat grafting, it's a transformation, but a very natural one. The same as we would do when a young lady has no lips, thin lips like mine, or no cheeks. It's very feminine and beautiful to have fuller lips and fuller cheeks within the natural range, and this is a positive transformation. Now, filler versus fat grafting quickly. Fillers are quick. They're done in office, very minimal, if any, downtime. There is an enzyme, we can melt some of it if we need, so there's a safety measure. And they last longer today. They last 15, 18, some 24 months. So it's by far the most common route, especially for younger patients. Now for older patients and for patients who want something more permanent, we do fat grafting. It does come with a 2 to 3 week swelling, a bit of bruising. Some of the fat will melt away, so we quote 30 to 70% fat loss with grafting because all the fat cells have to acquire a blood vessel to survive. Not all will, and for that purpose there will be a 3-week delay between today, which will be slightly overfilled, and the final result 3 weeks, 6 weeks, and then 3 months later. But usually at 3 weeks they're relatively healed. They can be social, and then the final result I kind of say 6 weeks. Fat grafting is permanent. We don't want to overdo it. The fat that's grafted to her face will always behave the way where it came from, like hair when we do hair transplants. So abdominal fat in her face will grow if she gains weight and will shrink if she loses weight. Fat grafting is a wonderful addition to our plastic surgery procedures we often do with facelifts and all facial procedure. And sometimes we do it isolated, like this young lady who does not want to repeat the fillers every 2 years. Thank you very much for watching.